So we're looking at part 14 of hydrotherapy theory and practice, looking at the underlying basis of the practice of hydrotherapy as well as the theory that goes behind it. And we'll continue on in this series here. So as a reminder, as you navigate any health challenge, always want to partner with a medical practitioner that shares a similar philosophy of care that you do. And we're just talking about various tools that you can put in your wellness toolbox for maintaining health or regaining health. And any protocol, procedure, treatment that comes your way, you should duly do your due diligence to check it out and make sure it's actually going to work for you and make sure it's safe and effective. In January 1903, Thomas Edison made the statement, a bold statement at that time, that said that medicine wouldn't be used in the future, but they'd be instructing patients in the care of their bodies and in what they eat and in preventing disease. But that wasn't that new. If we look at what was stated back in 1885, actually, in Counsels on Diet and in Testimonies for the Church, Volume 5, it says there's only one way that heaven approves of practicing the healing art, and it's simply using the remedies of nature that God has made. And they aren't taxing, and they don't debilitate the system, and they are powerful. So pure air and water, being clean, proper diet, purity of life, that is your soul, and a firm trust in God are remedies that many are dying because they lack. It takes skill and work to do that, and many don't appreciate that. We're in a quick fix society, and it's important that we look back and look at some of those remedies that are powerful when skillfully applied. They're very much less expensive and don't hurt the body in the process. And 3 John 1 verse 2 talks about our soul prospering and how our health it will prosper in conjunction with that. And that's something that we really need to pay attention to. If our soul is vexed, if we're angry, if we're upset, if we're guilty, all those different things can really tax our system and bring our immunity down and cause all kinds of additional health problems that we wouldn't have if we had some of that underlying soul time taken care of. I beseech you, therefore, brethren, by the mercies of God, that you present your bodies a living sacrifice, holy, acceptable to God, which is your reasonable service. It's not extraordinary service. It's just reasonable. And we're admonished to not be conformed to this world, but be transformed by the renewing of your mind. So we need to see what the world's doing, look at what God has asked us to do. If they are incongruents, we need to follow what God has asked us to do, that you may prove what is that good and acceptable and perfect will of God. His will is that we are healthy and that we're strong and that we are reflecting his glory to those around us, which is essentially his character. In Faith I Live By from the Ministry of Healing, it's noted that the body of mankind is the temple of the Holy Spirit, and he lives in us. And with that knowledge, it should be very, very high incentive to care for our bodies and preserve our physical powers and develop them. We're fearfully and wonderfully made, and it should be our study to know how to preserve it and keep it from harm and defilement. So we're going to continue looking at the wet sheet pack theory and practice here to begin with. And we noted at the beginning of part 13 that there were 4 different stages that the wet sheet pack goes through. The cooling wet sheet pack, the neutral wet sheet pack, the heating wet sheet pack, and the sweating wet sheet pack. You can stop or prolong the wet sheet pack, and that's determined by what you want to have the outcome be. So you can prolong them or stop them by any intervening at any point within that 4-stage process. So here's the bundled up burrito of a person in a wet sheet pack. It's a fairly cozy position, and it may actually be, for those who are claustrophobic, could be a little bit restrictive. But typically at that time, if they're ill, they may be just glad to rest. And this is very good for insomniacs and other people who need some just warmth and a hug, essentially. So that wet sheet pack is going to be kind of bound around them and probably give some similar therapeutic benefit. So the first one is the cooling wet sheet pack. So this is the stage before the wet sheet pack has been warmed to body temperature. So it's about 5 to 12 minutes right after you've wrapped the individual in that wet sheet and put the blanket around them to insulate it. It will be wet, and as it's warming, that is the cooling portion of it. So it's doing pulling some thermal activity away from your body as the heat capacity of water is increased as the warmth of the body is put into the water and warming it up. So it can be intensified by reapplication of the fresh, wet, cold sheet. So if you want to prolong that period, especially in fevers, you can just quickly turn that blanket back and sprinkle wet water on it if a sheet exchange isn't practical. Otherwise, you can just do a quick reapplication of the cold, wet sheet every 5 to 12 minutes as need be. So there's two different ways. You can do that: complete sheet repack, or just pull the blanket back and reapply water. And that'd be cold, ice cold water. And that's going to pull off BTUs or energy, heat from the body. And this is great for lowering body temperature, especially in typhoid fever that has a prolonged fever associated with it. Malaria might be a good one too. There are other different types of high prolonged fevers that can be very debilitating, but this can help bring it back down and into a realm of feasibility. So looking at different types of thermometers, we have the centigrade system. So anything above 38 for sure is going to be a temperature, and 38C. 102 is definitely above body temperature. 98.6 being the baseline for normal body temperature in the Fahrenheit scale. The next one is the neutral wet sheet pack. So this becomes the second stage when the temperature of the pack meets or exceeds the skin temperature. So up until this point, the skin temperature is lower because it's been covered with a wet sheet and it has the cold water associated with it. So it's going to be drawing that temperature of the skin down. But once it kind of goes into that heating phase, it will become warmer and equalize with the skin temperature. So the body will be warm and moving forward in the reaction. You can prolong that by removing blanket coverings. So instead of having the blanket wrapped around tight, you can extend that neutral wet sheet pack by not allowing it to continue to heat up. So keep the body warm, and by keeping that wet sheet pack around, you want to prevent circulating air from kind of acting like a swamp cooler and accelerating that evaporative cooling process that can happen. So this is very good for people with insomnia. It can help people rest and sleep. So helpful in mania, alcoholic delirium, or restlessness that could be causes of insomnia. And our little infographic here could be the wet sheet pack could be helpful in things like jet lag. People have insomnia because of the time zone changes. Maybe they're emotionally upset or angry, various stresses that they're thinking about and just cogitating on. Various medications can also keep one up late at night, as can eating too late in the evening, a heavy meal. Beverages of different kinds can also do that, as well as excessive screen time, especially into the evening hours with that bright light. So you don't want to have bright white light at night. That can definitely interrupt the sleep cycle. And that is one of the issues that we see, kind of odd things sometimes in people's sleeping behavior around the full moon, if they're exposed to that white light. We may also see that happening in our LED stage of lighting. If you go above 2700 Kelvin, you get into daylight, which is, 5,000, 3,000, 5,000, 6,000. That bright white, especially at night, is going to have an effect on your sleep cycle. So 2700 Kelvin is closer to just regular incandescent bulbs, which is close to candlelight or gaslight, really, and kind of more of a warm glow to it rather than a bright white. So that can be helpful to know that. And in fact, people who don't sleep in a dark enough environment, if there's too much light, it can disturb their sleep too. So sleeping in the dark is actually a very good thing for insomnia prevention. So it can also be used, the neutral wet sheet pack can be used to substitute for a neutral bath. The bath is more effective, but use as it's practical. So maybe you don't have a lot of water and you can't do a bath, or the person isn't able to be in a bath for some other reason, a wound or something. The wet sheet pack may just be the most practical application method for the particular circumstance. So the heating wet sheet pack is a third stage. So this reaction has become active when the body temperature raises above normal. So you should be monitoring the body temperature of the individual you're working with. As their body temperature rises, that is an indicator that their whole core is heating up. It's not just a surface temperature, a surface decrease or increase in temperature, but a whole body core change. So the heating wet sheet pack ends when sweating begins. So then the body is going to begin attempting to self-cool through evaporative cooling by producing sweat through the pores. So the best results if the sweating occurs for 20 minutes. Sweating is a fundamental cooling mechanism, but it's also the mechanism of which toxin release can come through the skin, in addition to the cooling factor. So the heating wet sheet pack can aid in warming the body. So if the goal is to warm a person, bringing him up to that point is good. You can reduce localized congestion in the body, wherever that congestion might be, with a simple whole body systemic heating wet sheet pack application. So if you have a localized congestion in the kidney or in the stomach or other organs, a joint, whatever it might be, this is one way to help to ameliorate or mitigate that. And then the fourth stage is the sweating wet sheet pack. So it begins when the generalized sweating begins. So you can increase it or extend this phase by adding more blankets. You can put hot water bottles, that should be hot water bottles, between the layers of the blankets. So there's a rubber hot water bottle here on the side. You can even put that down by the feet to help increase the warming. And then you can actually increase warming by drinking hot water or lemonade. Some hot beverage, doesn't have to be lemonade because there's sugar typically in that, but warming from the core. So a cold compress of the head, infrequently used, but enough to keep them cool enough, because you don't want the head to heat excessively because the neurological tissue is sensitive to temperature. So some uses for the sweating wet sheet pack. So childhood fevers, capillary bronchitis, cold, obesity, obese rheumatism are places where this stage of the wet sheet pack can be beneficial. So the heating and sweating sheet packs are good for alcoholism, gout, the flu or influenza, and nicotine release from those who may have been using that drug and other drugs as well, like alcohol. So it reduces the cravings by helping accelerate the toxin release. So if you have a child who has a fever, you can have a full hot tub bath and then a cold wet sheet pack. So the hot tub bath, many times when someone has a fever, they're cold, but their body is actually warming. So you want them to feel warm, and then put the wet sheet pack on. And it can often help people sleep. Kids who are just tired out from the fever cycle can just fall into a blissful sleep many times when a wet sheet pack is applied in their situation. The next aspect of hydrotherapy that we'll look at are local hot and cold variations, essentially using hot and cold alternative treatments. It's referred to as the alternate compress. So you're going to use very hot, followed by very cold, and then alternate immediately, one following the other. So you're going to do that for several cycles. 3 is kind of the most often application. So you can do a little bit longer than that, but there tends to be reducing reaction benefit past 4 or 5 times that it's alternated. So you don't want to do that indefinitely. So some of the benefits, you want to rapidly and intensely increase the circulation wherever that methodology is used. So doing the hot, cold. Basically, it's drawing blood to and away with vasoconstriction and vasodilation. and basically acts as another kind of a blood pump, like the heart. Helps eliminate pus formation. So again, it increases circulation in the removal of toxins and degradation in an area of concern. Helps to avoid bed sore formation. So someone who is restricted to a bed, lying down position, they can get hot spots that develop due to pressure points from prolonged bed rest in a particular position. By doing a hot compress on it, it increases circulation there and can help that heal and avoid bed sores from forming. Very good in typhoid, tuberculosis, or other wasting diseases in that it helps to move the blood around, and bed sores are often found in people with wasting diseases that are laying in one position for a prolonged period of time. And that's the primary aspect there of the bed sore formation. So you can use it on paralyzed limbs. So this may actually be helpful in someone who's had a stroke to increase blood circulation to the limb through doing alternate compresses. And by increasing circulation, you can increase potential neurological regeneration in that area. So our peripheral nerves have the capacity to regenerate. Our central nervous system, there's some indication there is some minimal ability to regenerate. Mostly been thought that central nervous system tissue does not regenerate, brain, spinal column, but the peripheral nerves that extend from that have the ability to, if given the right conditions. And one of those right conditions is adequate nourishment and adequate removal of waste and toxins from that area. It can be helpful in treating chilblains. So chilblains is essentially a blood vessel change that occurs when you've had repeated cold exposure to a particular area, digits, limbs, for example, that has not been frostbite, but has been very, very close to that in a repeated way. So it can help that by increasing the circulation to those areas. Edema, so edema of the abdomen and chest, it can help with that. Pleurisy and pneumonia, and chronic acute inflammatory diseases like pleurisy and pneumonia. So again, it moves the blood circulation to and from the areas and helps to remove waste and bring in nutrients and oxygen to the areas. So some places that you can use that. So using alternate compress to the spine, this can arouse an individual from a poisoning, so morphine derivative poisoning, alcoholic intoxication, opium poisoning, and other drug intoxications. So you're going to be applying this hot compress, alternate cold, hot, cold, hot, cold, hot, cold. So end with cold, start with hot, specifically to the spinal area of the back. So John Harvey Kellogg relates an instance where he saw a case of opium poisoning where the patient's pulse was less than 20 and the respirations were around 4 per minute. That's very slow. Hot and cold applications to the spine were quickly brought the pulse to a nearly normal count. The respirations were 12 per minute within 5 minutes. And the change in the entire direction of the case was so marvelous as to seem little short of a miracle to those who were watching, who had never before witnessed the powerful effects of thermic applications properly managed. So this is from an experience that Dr. John Harvey Kellogg relates from using hydrotherapy. So when you're applying the alternate compress, it's the same procedure as a fomentation, only you're going to have a hot fomentation rather, with a cold rotation added in between. So the picture on the right there is of a hydroculator that is warming a warm pack. But you can do that same thing with wringing a towel out from boiling water. You want to place that wrung out towel between 1 to 2 layers of toweling because you don't want to scald the person or burn the skin. So that's going to be an insulative layer between the hot towel and the skin. Carefully place upon the person a blanket that covers it, insulated it, and then change it in 3 to 5 minutes for a cold compress. So you put that very hot layer. It's going to be a moist heat. It's going to be pretty hot to start with and then diminish over a 5-minute period. Then pull that away. It won't be completely cool, but that's not your objective. Your objective is to create a vasodilation, vasoconstriction rotation. So you're going to replace that with a cold compress. So wring the cold water from a towel and apply to the same spot that the warm was. and then frequently keep it replaced to keep it cold, for the same duration as the hot. So you can leave it on for a little bit longer if you wish, but the cold application should be for the same amount of time. So once you've had that on there, on the place that the hot fomentation was prior, then you want to remove and dry the area quickly, and then reapply the hot, and continue alternating. So always start with hot and always end with cold. Make sure that they are ready to rest in a place with a draft-free environment following, because it can be rather energy consuming to go through this. And it's actually, you need to be quite set up and organized when you do this treatment. Maybe even a helper would be helpful, so you can efficiently do the exchanges of the warm and the cold and have things dialed in for the person you're working with. So the top picture shows some different ways. All the pictures show some different ways that you can do the fomentation. So the ice water could be in a dish pan with ice in it, and then the warm hot water could be, the hot packs could be warmed in a hydrocollator like I showed earlier, or even a microwave, or just a boiling pot of water, or a teapot. And that's going to all depend too on the size of the area you're working with. If you're working on a finger or a hand, it's going to be a lot less surface area you're working on than if in the chest area, or some other large surface area like the spine. So there's different ways to do it. You just need to find out what works best for you with the tools that you have at your disposal. All these things are fairly easily obtainable and readily available in most households. So review the things that we talked about here tonight. You can go back to preparingforthetimeoftrouble.com and look there for a review of that, as well as a review of past presentations and looking for future ones.